This is really a big Trojan horse, because if you look at law today, there is nothing holding back co-ops from existing now. There are nonprofit co-ops doing healthcare right now, but in this new plan that the senators, only 6 of them in the back room, know what they're saying, from the perspective of what they're trying to cut a deal on, they want to put government money into these co-ops. This is, and even if you look at Harry Reid's words, he says this is the government plan, just calling it something else.
All right, but it would be 50 government plans, right? Because you'd have 50 states running this, but the federal government isn't just sitting there with its hands behind its back. Right?
No, it'd be state by state, but how does that drive down cost? You and I, if we buy in car insurance, we could call anybody in the nation and get car insurance, help drive down the cost. These co-ops would only be within states, but why would the federal government have to put billions of dollars in to start a co-op? That would give them a benefit over any private plan.
You know more of this than I do, Congressman, but apparently they haven't even gotten to the particulars how you finance them. They do say that there would be some mathematical method to this madness, that if you flood a co-op that has 25,000 and put 50,000 individuals in there, 100,000 individuals in there, exponentially the cost factor and the savings factor grow. Do you buy that?
No. What stops them from doing a co-op today? There is nothing. A co-op can exist today and have a health care plan.
But the government can put it, believe me, I'm not endorsing one or the other. I'm just saying the government could put it on steroids, right?
Oh, the government can, and that's the government plan over on the Senate side. They believe there's been a holdup now when it comes to saying that you have a government-run plan. So Harry Reid is quoted as saying, look, it's a government-run plan if I call it a co-op or not, but we're going to get it out there. Part of the idea is they're stalemated here while we're supposed to leave on break come this Friday. They're throwing anything out, much like your analogy of Billy Martin.
What they're throwing out is the idea that they go home with this sort of out there on the table, passed in a key committee, and it sort of keeps the place setting at the table. So they can argue they didn't do squat. But time is a big issue, right? Because the more your constituents, I'm sure their constituents, hear and read about this, the more worried they get. So doesn't the time factor work against them?
Time plays a very big factor. That's why when I was walking out of the Capitol this morning, who comes walking right across the door was Rahm Emanuel, the chief of staff to the president, going in, trying to bring individuals on the Democrat side together. There is a rumor out there that 4 of the blue dogs who serve on energy and commerce have cut a deal to keep the government plan in. They trim it by a few $1 billion.
Did Rahm recognize you, Congressman?
Yeah, but he doesn't sit down to try to twist my arm.
Oh, so he didn't say nice things or nothing, huh?
No. He was on a mission going over to the Democrat leadership office, trying to put some blue bogs together. And so the rumor has it that they've got 4 of them that serve on energy and commerce. They were supposed to go back at a meeting tonight. They have now postponed that. That is Waxman's committee where the bill is held up. They say they're going to meet tomorrow at 10. This bill continues to change by the hour.
I got you, sir. But do you think the pendulum, you know, if you had to rate it yesterday, it looked damn near impossible. Is it slightly more possible today? What do you think?
I don't think so, because it's hard to make it happen when they're supposed to meet tonight. They don't have the deal. Tomorrow night's a hard time. And part of the deal that these blue dogs have on it is not to have the bill come up to the floor. So I think that makes health care a little harder to do, especially if people are going to go home. They've heard about this bill. They see a government takeover. They see the trillions of dollars are going on. They see 1,100 pages in here and no reform happening in health care. They don't have the costs coming down. They don't have the quality going up. This is not the answer of what the American people are looking for.
Congressman, always fun having you. Thanks for joining me. Congressman McCarthy on Capitol
Thanks for having me.
Or, well, no offense to the Republican